I can't tell you the number of times our agency, we sit down with folks who are approaching retirement. They are scared to death. They don't know what to do. And quite often, they're still working only for the health insurance. They're, 62, 63. They've got plenty of money to retire on. Their financial advisor is advising that they retire. But all they've known for the last 40 years of their life is getting up in the morning, going to work, coming home at night, and then rinse, wash, and repeat day after day, month after month, year after year. And there's this regular angst of not knowing what the next steps look like. And so as we sit down with folks as they approach retirement, the number one thing I want to that we recommend to them is don't feel like you have to work just for the health insurance. Usually we can figure that piece out as you move into retirement because nobody wants to work until their health runs out. So it's okay to take a look at other options if you're in your early 60s or late 50s to retire so you can enjoy the quality of life you've worked so hard for so long to be able to enjoy at this stage of life. But it does require some planning. So we call them at our agency just a retirement planning session where we sit down with you, your family, potentially your financial advisor, and we begin to unpack for you what it would look like if you were to retire and be able to get health insurance on your own. And while that feels like a daunting task, quite honestly, it's never near as scary as what most people think. Most people recognize the fear that happens is just from the unknown. So being able to come alongside of those folks, turn on the lights, be able to help them understand how does the Affordable Care Act work? What do pre-existing conditions look like? Are we able to travel with our health insurance? What does it look like if we wanted to buy plans off market? And how can we put together a sustainable plan that we know will get us from retirement age until age 65? Why age 65? Because at age 65, everything becomes simple. You transition to the Medicare system. Now, there's a couple different ways to do it, but the way that most of our folks do it when they retire is to go to traditional Medicare, buy a supplement, get a Part D plan, and for probably $300, maybe $350 a month per person, they've got coverage they can use anywhere in the country, see any doctor they want, get access to care anywhere that takes Medicare, which is about every place, and have an out-of-pocket maximum of $283 for the year, and that's it. So that's the light at the end of the tunnel. So as you retire at 62, we don't have to solve a health insurance problem for you for 30 years. We really need to figure out a strategy that gets you from 62 to 65. So be willing to approach this topic with clarity. Be willing to approach this topic without fear, and be willing to sit down with somebody who can turn the lights on for you and help you solve that problem.